Dental patients have any number of reasons for rejecting your proposed cases. After the break, I'll be back to tell you why learning to accept those rejections can actually help you retain more patients. Stay tuned. I'm Colin, founder and CEO of SmartBox, and welcome to the Patient Attraction Podcast. Dental selling is something that many dentists never really get comfortable with, and that's a shame because you can't help a patient who rejects your case solution. Now, even worse, a lot of dentists take rejection personally. They figure that they must have had the wrong approach or the wrong tone of voice or the wrong explanation, or their patients would have agreed. Now, I also see dentists that I'm not sure understand how to present cases, and they come across as lecturing to the patient, and patients don't want to be made to feel guilty or lectured. Now, that's not the main reason that patients don't agree to your proposed treatments. Many dental patients go into your case presentation believing that they're not going to accept anything more than what you've already done. Now, that may sound idiotic, but it's true. Your patients have heard horror stories about dentists selling unnecessary work. And in fact, if you look at consumer confidence in dentists over the last 10 years, it's been on a steady decline to today where dentistry is in the top 10 most untrusted professions out there. To those patients, to your patients, your case, your treatment plan is the equivalent of a used car salesperson's pitch. Now, that attitude has nothing to do with you or the worth of your solution. It's a self-imposed delusion that keeps those patients from accurately evaluating what you're trying to help them with. Now, other patients are prepared to reject your solution based on the cost or the inconvenience factor. Now, unless you're seriously lowballing your prices or going to ridiculous lengths to minimize treatment times, there's nothing you can do to convince them. And I would caution you against trying to lowball on your prices. The race to the bottom is a slippery slope. Dentists that can't relay the value or what they're doing has no value rely on price to sell what they do. Now, again, your patient's rejection has nothing to do with you unless you're making some of the big mistakes. Now, finally, let's talk about that some patients reject your solutions because they're afraid of pain or disappointment or embarrassment. But with work, you can convince some of those patients, but not all of them, because some emotions are irrational. That means that, your logic and reason probably isn't going to help, but working with them, having a lot of empathy, relaying and being relatable to what their needs and problems are will help you overcome some of those problems. If you accept that the problem with your case presentations isn't you, you're actually going to sell more of your solutions. You'll relax. You'll keep from unintentionally sending physical or verbal signs that your patient might misinterpret, for instance. Now, you know what the worth of what you're offering, your treatment plan is. Just make sure your patients figure that out. You can attract more patients who value what you offer. If you want more information, go to smartboxwebmarketing.com. Keep moving forward.